Hello, Dr. Bell. Are you ready for your LASIK surgery?
Very excited.
Good. Well, come on in. This is the Wavelight Allegretto laser. We've been using it now for almost 3 years. It's a flying dot laser that we've talked about in our preoperative assessment, how once we lift the flap back, it makes a very smooth treatment and gives her hopefully 20/20, or what I call 20 over happy vision, similar to what she sees with her contact lenses. We've covered one eye here, the untreated eye for now, and we're going to treat the right eye first. Now, this is a somewhat sterile procedure, so we all wear a mask and a hat and surgical scrubs. We've not really had an infection, but we always work hard to prevent that. Okay, first thing we'll do is we're going to drape the eyelashes out of the way with a little sticky drape. So I'm real good to talk to Dr. Bell and let her know what we're doing. Okay, the next part is the lid speculum. Patients are always concerned about how to keep their eyes open, and we have a little instrument that does this for us. There we go. That keeps their eyelids out of the way. Why don't you raise your chin a little, Angie? Thank you. And now we're just going to focus the laser above her eye. The other thing patients are concerned about is their eye moving, but there's a tracking device in this laser that follows her eye during the treatment. Now, the first thing we're going to do, Angie, is we're going to mark the eye. This makes a little purple mark on the eye. She's being a great patient. She's holding real still for us. Okay, the next thing we're going to do is put this little device on. This device is a suction device that fits onto the eye. It causes about 10 seconds of pressure, but it's no worse than just holding your fingers above the eye. Okay, suction on. Lots of pressure, Angie.
Building.
You're doing great. The next device is a keratome that we use to make the flap.
Capture.
You're doing great, Angie. This is making the flap. Suction off. There you go. Now, once we take that off, that's created a flap, and you can see this little purple mark we made here will help us to put the flap back into position. Now, we're going to use this instrument to lift the flap. You have a perfect flap, Angie. It's well centered. Now we're going to use this little paintbrush that smooths it out. A little more water. Good job. Now that just smooths everything out. Once again, we're just focusing the laser above your eye.
It's going to be 20 seconds.
You turn it down just a little bit.
Yes, sir.
That's good. Okay, everything's centered. You just look at the green light, and we're going to turn on the tracking device now.
Center and ready.
So if her eye moves, the laser will move with her. Now we're going to start the treatment, Angie. You're doing great. It makes a little buzzing sound. You're doing good. We're halfway done. You're doing super.
75.
On the home stretch, Angie. See, that's all there is to the laser part. We're going to put the flap back into position now. Good. The flap goes right back where it came from. We're just going to float it with a little bit of water. Good. And once again, you can see how we're going to line up this little purple circle over here. I'll turn the light up a little bit. There we go. And we're going to use this little paintbrush to put the flap back in position. Good. The flap is designed to cover the treated area, so Angie won't have any pain. She'll have a little bit of irritation, but it's no worse than maybe having your contact in backwards. But it gives us the chance to treat both eyes and have really good vision right after the surgery. Okay, we're going to put some antibiotic drops in again. Okay, we're going to switch to the other side. Good. Good. Take these little sticky drapes off. How you doing, Dr. Bell?
Just fine.
All right. Looks like you had a perfect surgery there.
It didn't hurt at all.
Good. Even that little suction device, did that bother you?
It wasn't bad.
Yeah, it's just some pressure for about 10 seconds. Okay, we're going to cover the eye we just treated. Let's get these lashes out of the way again. Okay, the next part, once again, we're going to open your lids very gently. This is really, when I had LASIK done about 10 years ago, this is really what bothered me, was just the stretching of the eyelids out of the way. And the lights are sort of bright under here, but we dim them right before the treatment. Okay, we're just lining her up again. Okay, now the little purple mark that'll help us put the flap back into position. You're just a perfect patient, Angie. You're real easy to work with. Now this is that suction device again. Okay, suction on. Sorry, had to push a little bit.
Still building.
Okay, you're doing great, Angie. Okay, here's the keratome device that makes the flap. Good. You're doing great. Suction off. Okay, we'll remove the device. And that little instrument makes the flap. Good, we're going to lift the flap. Looks just like your other eye. We'll smooth things out with the paintbrush again. Maybe just a little more water. Thank you. Okay.
It's going to be 20 seconds.
Okay, we're just going to get it focused above the eye. Okay, Angie, keep looking at that blinking green light. There's a little fixation light that she's looking at under there. We'll go ahead and set the tracking device.
Center and right.
Okay, I'll cover the flap for protection. We'll go ahead and get started. We're a quarter of the way done. You're doing great, Angie. The laser is actually invisible, so she can't see the laser, but she's looking at a strobing light up in the laser as we're doing the treatment. All done, Angie. Let's put the flap back in position. The laser does the treatment based on some measurements we've done in her preoperative examination. She has a -4 for her nearsightedness, which we program into the laser. And the laser does the treatment. I just put my foot down on the pedal and it does the treatment automatically. So I just got to make her a good flap, make sure it's centered, do the treatment, and put the flap back in position. Let's float her one more time. We make sure the flap's in good position because we don't want any wrinkles or debris under the flap. And I'm going to float her flap one more time here with some water. Good. We want to make sure that interface is just as clear as possible. Good. Wait for just a second. It doesn't take any stitches, but the flap lays down in position all by itself. Once again, we're going to put our antibiotics in. And we'll take the speculum out and the sticky drapes. Well, hopefully that wasn't too bad for you. There we go, sorry. Have a little gauze, and then the laser is going to bring you out from under it. You feeling okay?
Oh yeah.
Good. Now, first thing we have to ask you is see if you can tell what time it is on the clock across the room.
It looks like it's 12:33.
12:33. Can you count the seconds too?